It was shocking. It was all-encompassing. My world shrank to my body. And I had a big world. And it literally, it was overwhelming. Originally, we thought I had just one tumor in my right breast that was pea-sized. And I was told, you know, Mrs. Stone, you have nothing to worry about, it's teeny-weeny. An MRI showed that I had another tumor in my left breast. At that point, I still struggled with the decision to have a mastectomy. All of the options were presented to me. All of the risks were presented to me. And that probably panicked me even more. And just having to absorb that. And this is, you know, my business is in medical research, so I know that the risks need to be presented to the patient, but when it was when my feet were in those shoes, I was scared. We talked about having silicone implants, and that I would possibly need to have expanders put in during the time of surgery, but that I might not, and that I might be able to directly have the implants done, which would be done simultaneously to having the mastectomies. It's a long surgery, and luckily for me, that's what happened, because I did not have to have further surgery, although that was very clearly explained to me that I might. The post-surgery, I think, is something that, while it's explained, it's something that you're not thinking about. You're thinking more about, you know, am I going to be disfigured? The great things are you're thinking, wow, after 62 years, I'm going to finally have the breasts I wanted when I was 13. That's not necessarily true either. And I think the other thing is that you think, well, when this is all over and when we take the bandages off, there they're going to be. I was very assured, as everything that was said to me, in fact, happened. And then I started to realize these people actually really do know what they're talking about. They've experienced it. I'm in a car with a team, and different drivers are driving, but they're all in the car at different times. So while Dr. Baker was driving, and then Dr. Schimpf was driving, and at some point my oncologist was driving, I did not have to repeat myself. I really felt like everybody knew what was going on, knew some of the foibles, knew what my labs were all about, knew what the different things that showed up on an MRI or didn't show up or were in the tissue, and so I didn't have to constantly repeat myself. And that made for a much more cohesive treatment, and made me very comfortable. And I still feel like this is my team, and this is the team that I'm going to be with. And also, as people were making appointments for me, as the physicians were making appointments for me, they would look to see when you were available and try to do it so that it was very convenient. I feel very, very, very good about MUSC. You know, a National Cancer Institute designated facility. We've only got, what, 54 of them in the United States. I feel very good about the treatment that I got.